"You'll never run again." 4 words that a surgeon said to a patient of mine after knee surgery. 10 months later, that patient crossed the marathon finish line. This is his story. I'm Raj from Kinesio Rehab, and this case reminds me why I never accept never as a diagnosis. He was a recreational runner in his early 40s, loved long distances. Marathons were his passion. Then a meniscus tear required surgery. The procedure went well, but during the post-surgical consultation, his surgeon told him that running, especially marathon distance, was no longer advisable. The wear on his knee, combined with the lost meniscus tissue, made it too risky. He was devastated. Running wasn't just exercise for him, it was his identity, his mental health outlet, his community. Being told he couldn't run was like being told he couldn't breathe. When he came to me, I was honest. I said I couldn't guarantee he'd run a marathon again, but I could guarantee we'd find out what his knee was truly capable of through systematic progressive rehabilitation. We started with basic strengthening, quad activation, hamstring curls, calf raises. His leg had lost significant muscle mass from the surgery and the weeks of inactivity that followed. We rebuilt the foundation before anything else. By month 2, we introduced controlled impact, walking on a treadmill with gradual incline increases. His knee responded well. No swelling, no increased pain. By month 3, we started a walk-run program. 1 minute of jogging, 4 minutes of walking. Repeat. We monitored his knee after every session. Swelling was our guide. Any increase meant we'd gone too far. Month 4, he was running continuously for 20 minutes. Month 5, 30 minutes. Month 6, he completed his first 5-kilometer run since surgery. He messaged me afterward. Just one word, crying. Months 7 through 9 were about building distance safely. 10% increase per week, never more. We tracked his training load meticulously. Strengthening continued alongside running. Every week we tested his knee strength ratios to ensure his surgical leg was keeping pace with his healthy leg. Month 10. Race day. He ran a full marathon. Not fast, not for a personal best, just to prove that never was wrong. He finished in just over 5 hours. And when he crossed that line, he wasn't just a marathon finisher. He was proof that the human body, with the right guidance, patience, and determination, can overcome what experts say is impossible. I don't share this story to give false hope. Not every surgical patient can return to marathon running, but many patients accept limitations that are actually just unopened doors. If you've been told you can't do something you love because of an injury or surgery, get a second opinion from someone who specializes in rehabilitation. WhatsApp 01293499471 or visit kinesiorehab.com.my. Never is not always forever. I'm Raj. Tomorrow, the 24-hour rule. How to know if your physio session was too intense. See you then.